Welcome to the Weird Works podcast. I'm Dr. Kristy, your host. Join us for conversations about alternative and sometimes controversial healthcare topics. This podcast will provide the evidence that you need in order to make informed decisions about your health, to empower you with the facts that you need to advocate for your health, and to encourage you that there is hope your body heals. Join us from experts from all things weird, as well as the testimonies of people with stories of radical healing who were once told that perhaps their condition was a death sentence, that they would just need to live with it, or that drugs and invasive surgery were the only answer. Let's get into agreement that if there is something natural and non-invasive that could be helpful, that it could be your first option rather than your last resort. So welcome to our functional lab interpretation course. I'm going to share my screen, and the first thing we're going to do is talk about the difference between how a functional doctor would interpret labs compared to a traditional doctor. So just by a show of hands, can you guys tell me who has labs in front of them? Or you guys can put it in the chat. Okay, awesome. Good job. You did your homework. And out of the people who brought their labs tonight to class, how many of you were told that they're all normal? Okay, about the same amount of hands. And then how many of you, maybe there were a couple of flags, like values were maybe high or low, but your doctor maybe didn't really tell you what that means. They're kind of just swept it under the rug. Okay, some more hands. Yeah, so what we find is even if doctors are ordering these labs, they don't really spend a lot of time hand-holding or educating people on what they mean. So we're going to empower you to kind of read some of your own labs. And then after tonight, if you have additional questions, because of course this is a group, so I can't interpret everybody's labs in a group format. But if you have additional questions or you want me to read your labs like on a one-to-one setting in a more extensive setting, we can totally do that. We can schedule that. We can do it virtually, or we can do it, sorry, I had to mute Linda. Or we can do it in the office and set that up also. Okay, so let's go to our slides. So in a traditional lab, what medical doctors are looking for when they're ordering lab is really to identify whether or not you have an active disease process. And by the time a lab will pop as abnormal, either high or low, it's often later in the progression of a disease process. So what we know is that these labs aren't always the most sensitive to find things early on. And they're using it to diagnose a condition, and then if they find a condition, all they can really offer you is to prescribe a medication for said condition. So I know some of my patients sometimes feel like they're using their labs against them because they don't, we're trying to be proactive and prevent the need for medications, or at least lessen the dependency on medications. And they're almost sometimes afraid to get their labs done because they know their doctors are going to kind of use it as evidence or ammunition against them that they need a prescription. And so I get that completely, but in our medicine, we're trying to use it as evidence to prove to the doctor and speak to the doctor in their language that you're getting better, that your diet and lifestyle program is working and moving the needle in the right direction, so that they will be willing to work along with us to decrease medications when it's possible and when that's the appropriate thing to do. In traditional lab work, your ranges, those normal ranges that are printed on there, they're pretty much the same for everyone. So it doesn't matter if you're male, female, it doesn't matter if you're older or younger, it doesn't matter if you're eating clean or you're on a keto diet or a specific regimen, and it doesn't matter how active or sedentary you are, everybody's given those same ranges. And so you're being compared to like an average American population. And sometimes, or a lot of times, I'm like, gosh, we don't want to be compared to the standard, what's become normalized as far as health statistics, because they're not really that great in America. So we often, our functional ranges are different because we're looking at different hopes and outcomes. We want better than those average ranges that are the normals. And often also in traditional labs, when they're reading them in the medical world, they just take them for face value. So it's either flagged as high or low, or it's normal. And when it's normal, it doesn't really rule out anything. But in our world, we're going to look at those normal values because they often have little hidden clues. So that's kind of how the traditional blood work lab interpretation goes. On the functional side, we're looking at it to make very proactive and preventative decisions on your health care, meaning we're looking for the early detection. So we don't want to wait until these ranges are way out of whack to then like pour on the heroics and try to do something about it. We know that if they start trending in an abnormal direction, we've found it very early on in the progression. And what we know in natural medicine is the sooner we find things in the progression of a disease status or an imbalance, the more likely that my medicine, being holistic, natural, is going to be a viable option for that person to reverse that condition. And sometimes I've noticed over the course of my career, when we dig back, like say a patient brings in blood work and it has an abnormal value or it has a flag being high or low, well, if we dig back and look at previous blood work, we could have seen that it was trending in that direction gradually, sometimes over 5 or 10 years. And in the medical world, because it was in the normal ranges, even though it was worsening and approximating that abnormal value, they don't do anything about it until bam, it pops and then it's abnormal. And now they're naming a condition and they're prescribing a medication. And sometimes that enrages patients because they're like, well, you mean to tell me that they were watching this happen and they knew it was going in that direction and nobody said anything to me that like maybe if I exercised or lost weight or changed my diet or, took some kind of nutrients that I could reverse it. And I'm like, yeah, unfortunately, that is the case. So we watch those trends. Our ranges in the functional world are age and sex dependent. So females, for example, your values might be different in the beginning of your menstrual cycle compared to the end of your menstrual cycle. If you're bleeding or not bleeding, if you're perimenopausal or postmenopausal, our ranges could be completely different. So if a woman, for example, is menstruating, their iron levels, just as an example that everybody can understand, are gonna be different than if you're postmenopausal and you're no longer menstruating, which can be a completely normal biological expectation. So that's just one simple example. We're using those values to try to optimize health and move things in a positive direction and find the root cause of why those values are abnormal in the first place. And we don't take them at face value. So tonight I'm going to show you maybe some simple calculations and some ratios that I do behind the scenes when patients bring me their labs before I meet with you to interpret them and make suggestions based on the lab findings. Because sometimes we have to compare one value to another value in order to really understand it in the whole picture of things. So that's a little bit different. And so the next slide we're going to talk about is going to be, we're going to first go over the CBC. So if you have your labs in front of you, turn to the page that says CBC on it. And I underlined with differential in hot pink for a reason. And so this is one of those things that sometimes doctors are very stingy with the labs that they order, and they sometimes only order a CBC, where if they could have just checked the little box and said with differential, we get so much more value and can offer you so much more as far as interpretation. If you don't have the differential, I can't really help you tonight as far as following along with us, but these can be calculated because they're percentages of the total blood count. So hopefully you have the differential. If not, we can calculate it on a one-to-one, or I could teach you how to do that after the course. Okay, so the CBC, first thing is the white blood cells. So your white blood cells is your body's first line of defense against infection, inflammation, or any kind of foreign invaders. So they're really important. And so if these values are high, usually it means there's something actively going wrong with your immune system. So you're probably fighting a cold or a flu or some kind of infection. And so it's measuring potential tissue damage. It can be high if you're having an autoimmune flare. So we see a lot of autoimmune conditions. I think sometimes people just think like leukemia is the last thing that's listed here, but high blood cells, I think everybody freaks out because they think immediately like cancer. Well, white blood cells are your body's natural defense mechanism. So if they're elevated, it just simply tells you that your immune system is chomping away at something. Now, if these white blood cells are low, what it means is that it can be immune suppression, but often it means that your body is now in a state of exhaustion. And we're going to see this trend repeated no matter what value we're looking at. So high usually means there's something active going on that the body's defenses are trying to work on, and then low can mean that process or fighting has been going on for so long that the values are now depleted and you've used up your body's resources. So that means a chronic state of infection or chronic viruses. In our world, we also know that the body can have dormant infections. An example of this could be Lyme disease that burrows into the tissues and will go through bouts of remission and then bouts of being reactivated. Another example of a dormant infection, a common one, is in hidden root canals that people have had, like past dental work. And often this can be going on and people have no idea, like they don't have tooth pain or jaw or swollen lymph nodes or any kind of cold sensitivity or trouble chewing on food, but that infection is so deep in the root and it's just using up your body's resources, running constantly in the background, and that can become a hidden source of chronic fatigue, inability to respond appropriately to even the right course of action, general inflammation, pain syndromes, etc. So that's a little background on white blood cells and what they're doing and if they're high or low. And so on your blood work, you'll see WBC, and the functional range for this is 5 to 8. So you might just want to make your own little flags or check marks or highlight some of the values tonight as we go along so that you can see how many flags. And I have a real live case that was actually from this past week. So I'll kind of bounce between some of this data because it gets kind of nerdy and sciencey, and not to overwhelm you with all this like science vocabulary, but we'll bounce between this and a real life case that we saw even just this week in the practice so you can kind of understand how we use this data. But for this person that I'm going to talk to, what was interesting is when we received her blood work, medically traditional flag, she only had 5 values on her blood work that were flagged as abnormal. And when I put her data into our functional ranges, we had 14 different flags. So can you see how different that is? So almost 3 times the amount of flags once we put it through. It doesn't mean she has 14 diseases, but what was cool is that we start overlaying the data and we started seeing common reasons why multiple areas of her blood labs were out of range. And then it pointed us to some commonalities as far as like, okay, let's go look at her liver, let's go look for poor drainage pathways, etc. So we kind of talked about it, infections, autoimmune, immune suppression, but stress, and you'll see stress responses repeated here. So in functional medicine, another difference that I could have put on the first slide is that you have to overlay this data with the patient's presentation and their symptomatology. Right. So like if somebody's under chronic stress, like we just had, people moved here, they're caregivers for their elder parents and they still have kids living under their roof. They're doing all of that and working a career or have 3 businesses between themselves and their spouse. Like that's a big stressful life event that needs to be taken into consideration before we jump to conclusions and diagnose them with a disease and prescribe them for a medication potentially for the rest of their lives. So stress is always something to look at. And then we have the red blood cells. And so the red blood cells are what carry oxygen to the tissues, and they also help remove carbon dioxide. So on the red blood cell side, if they're high, it could be a sign of dehydration. It also can be a sign of methylation deficiency or B12 or folate deficiency. So folate is B9. Does anybody know what methylation is? I gotta check your hands. Has anybody ever heard of the word? Even if you don't know it, have you heard of it? Yeah. Okay. And if you haven't heard of it, have you maybe heard of the genetic mutation MTHFR? Some not. Does anybody know if they have an MTHFR mutation? Okay, so that's a specialized lab. Some doctors test for it, some don't. That's something that we can test if we need to, but we'll probably do a whole nother one of this just on like functional ranges. But methylation is something that is really important. It's not only your body's ability to digest and utilize your B vitamins, but it's a process that happens in the liver and it helps your body with detoxification. And detoxification is related to everything, like your cholesterol levels, your hormone levels. So can you see how like one value doesn't just, okay, red blood cells. In traditional medicine, they like only think of anemia, right? Your blood cells are low, you're anemic, you need iron. And so then they send you to the doctor and you get a really synthetic form of iron. Oftentimes it's iron that's very hard to digest, and then people get constipated and they stop taking the iron and they think, oh, I don't know how to overcome this whole thing. So there's a lot more to the red blood cells than just if you're iron deficient anemia or not. Here's the word cortisol. So in our practice, a lot of our patients have some kind of cortisol exhaustion or adrenal fatigue. And so your cortisol can cause your red blood cell counts to be elevated abnormally. If your red blood cells are low, it could be mold. So we're doing this course from Florida. I see that we have people from all over the place on the call. So that's maybe not you guys, but in Florida, our mold experts here pretty much tell us that if you've ever had a water leak or water damage, you have been exposed to mold or are being exposed to mold. So again, you got to look at the patient, understand their lifestyle, their living conditions, much more than just analyzing their numbers on paper. You always have to overlay this with like the living expression, not just analyze somebody by numbers and values. And then if it's low, you might just not be deficient in iron. It could be copper and protein deficiency. And it also could mean that there's low sex hormones, whether it's estrogen or testosterone. So there's a little data on the red blood cells. So on our red blood cell, you'll see RBC on your blood work. And for females, the range is 3.9 to 4.5 for optimal. And for males, because they don't menstruate, it's a little higher, right? And so the normal optimal range for men is 4.4 to 4.9. So if yours is abnormal, go ahead and highlight it or check mark it or whatever you guys are doing. And then we kind of went through this, but it's just interesting to see some of the signs. So we put some of the symptoms here of anemia, and then you can kind of do your own little checklist. Like if you have shortness of breath, if your skin is pale, you tend to not have, a good flush to your appearance, dizziness or weakness, even poor endurance or recovery. That might be a sign of an iron deficiency anemia. Other deficiencies could be brittle nails, hair loss. People come to us all the time for hair loss. And while we love a product called liquid collagen for that, it also could be an iron deficiency. So oftentimes we'll give iron for hair loss, which isn't probably the first thing that people would think of. And then on the high side, if your red blood cells are high, some symptomatology for that could be really concentrated urine, which is related to that dehydration. Could result in headaches. How many people have headaches? That's a pretty common thing, so something to look for. Dizziness. So this is interesting. Now you're going to get some conflicting information. Dizziness could be a sign of high or low red blood cells. Rapid heart rate, rapid heartbeat, and low blood pressure are all signs of high red blood cells. And then impaired detoxification, like how would somebody really know if they can't detox? Well, symptoms of that could be just general inflammation, like chronic pain syndromes, feeling like puffy, or just tight and stiffness. It could be more obvious where there's swelling around the lymph nodes, which are definitely under the jawbone, but under the axilla, under your armpits, and in the groin are where there are also concentrated amounts of lymphatic drainage. So sometimes you'll feel like a fullness or just a tightness or general ache in those areas. And if it's really bad, you could palpate maybe a potential lump, or you could feel the chain of lymph nodes. So that's something that you could do a little self-check on as well. People that aren't detoxing well sometimes have fluid retention in the legs, where you might notice if you wear socks, you'll take them off and there's a line where the socks were, or your shoes will leave an indentation in your feet at the end of the day. I mean, there's always some kind of mark from your shoe, but if it's indented and it stays indented for quite some time, that's more what we're talking about. And so and then high blood pressure is common. So you have low blood pressure if your red blood cells are low, or high blood pressure if they're high. And here's a really interesting one: itching after bathing. So we've had a couple of patients where they think they're allergic to the water because they're itchy and their skin stays really red after bathing. But it could be a sign of high red blood cells, or a condition called polycythemia. So there's some extra data on the red blood cells. Now we're going to go into some of the red blood cell features. So these are, I think everybody might notice, recognize the word hemoglobin. Hemoglobin is related to carrying oxygen, or how much oxygen is in the red blood cells. But then you're going to see a bunch of values that are MCT, MCH, MCHV, all of the acronyms that start with M. What they basically are, as we go into this in a second, are going to be characteristics of the red blood cell. It's the size, the volume, and the shape of the red blood cells. And then when there's changes in the size, the volume, and the shape, it could be linked to different issues. And so that's just something for you to know. You don't have to understand all these crazy letters and numbers, but I think it's interesting because I think sometimes when we don't understand something or know what it means, we just get a blank spot in our understanding and we skip it, and then it causes confusion. So that's all you really need to know, is that those letters and numbers with the M's all relate to the characteristics of the red blood cells. So hemoglobin, if you're getting too much high hemoglobin or oxygen, you could be dehydrated. It could be a sign of lung disease. So here's something weird, right? You'd think, if I have lung disease, wouldn't I have less oxygen? Well, this is the body's innate intelligence to try to override a deficiency. So if the lungs aren't oxygenating the blood appropriately, the body tries really hard to get more oxygen to the tissues, because oxygen is so critical for our survival. So you actually can have high hemoglobin if there's lung disease. Super interesting. And again, if you have one of these values, it doesn't mean you have lung disease. Again, we have to overlay it and look at everything in combination. But it's just interesting to start to think about how you feel on a daily basis, some of your symptoms, and then if that correlates to anything I'm saying, then please bring it to our attention during your appointments, or if you're not yet a patient, reach out to us and let us analyze this stuff. Because again, if we can find it early on, a lot of times we can reverse these things before it turns into a big condition. And then on the reverse, if hemoglobin is low, it could be anything like an iron, B12, or folate deficiency. Sometimes that's related to liver because that's where these nutrients are synthesized and absorbed and methylated. That's the word methylation again. It could be a sign of poor protein absorption or not consuming enough, right? So sometimes deficiencies are because we are not consuming it, and then other times it's because we're consuming it, but we're not absorbing or breaking it down the way we need to utilize all the goodness in it. Here's a crazy one, parasites. So you can have hemoglobin could be low, and also ferritin, which we'll go over in a second. That's another form of iron. That's your stored form of iron. And parasites eat up, they love eating up your hemoglobin and your ferritin or stored iron. So there's some information about hemoglobin, and then we can overlay that with what does the person feel like. So on your blood work, hemoglobin is the acronym HGB, and our functional ranges for that, again, they're different. If you're female, optimal would be 13.5 to 14.5. And if you're a male, optimal range would be 14 to 15. So if you're low in hemoglobin or oxygen, mitochondria is going to show up a lot. So medical doctors know what mitochondria are because they learned it's the powerhouse of the cell, and every cell in the body has it. And the powerhouse meaning that's where your body actually makes energy molecules. And so when we have a deficiency in mitochondria, all sorts of things can go wrong because whatever organ that cell is in, if it's not making enough energy, it's naturally going to be impaired in whatever its said function is. And so if that cell is in your liver versus in your lung versus in your heart or your brain, the symptoms are going to be completely different. But mitochondria dysfunction is definitely something that functional doctors look at and can correct for. And I don't really know if there's anything that medical does for mitochondria. So again, you might be weak, you might be dizzy, have poor endurance. The same thing with brittle nails, hair loss. This is the same as the red blood cell findings. Very similar. Very similar findings also if it's high. So impaired detoxification, causing overall inflammation, could cause general pain conditions, dry mouth, concentrated urine, could be low blood pressure, brain fog, fatigue. I mean, these sounds like every patient that comes in, right? Every new patient has joint pain, fatigue, brain fog, anxiety. Pretty common. Okay, and then, oops, go back. Hematocrit they're all going to sound similar, so I'm going to kind of just push through these and maybe just point out the differences. Hematocrit is talking about the percentage of red blood cells in the total blood volume. But it has a lot to do again with oxygen carrying, and the highs and lows are similar to the red blood cells and the hemoglobin that we just went over. This one can also be low in heavy menstrual bleeding. So if anybody's listening and they have heavy menstrual bleeding, go look at your hematocrit levels and see if they're being affected. And again, here's the functional range. So on your blood work, hematocrit is represented as HCT, and the ranges are different for male and female. Females, the optimal ranges are 37 to 44%. In males, the optimal range is 39 to 55%. So again, if you've got your blood work next to you and you're outside of those ranges, just make a little check mark or highlight there for us. And we're going to skip over this because the highs and lows are very, very, very similar without a whole lot of change. MCV. So now we're going to get into all the M's. MCV is the volume or the average size of your red blood cells. This is super interesting to know. I know in chiropractic school, we spent a lot of time looking at a microscope and looking at these things. And if you come into the office, you guys, how many people how many of you guys tonight have done the live blood cell analysis with Miss Charlotte? Has anybody done that in the office? She comes to us every 3 to 4 months and does live blood cell, which is really neat because you get to see your blood cells. And sometimes it's cool because you can see the visualization of what we're talking about here. And you can see how red they are. You can see how well, if it has a good defined ring around the outside. You can see if they're small. You can see if they're donut shaped instead of round and plump. And those all mean different deficiencies, which are related to these red blood cell findings that we're discussing. So, yep, it's cool to see. Okay, so same, if it's high, could be B12 or B9 deficiency or a methylation dysfunction, which occurs in the liver. If it's low, iron or copper deficiency, it also could indicate a potential lead toxicity. So if you know you've been exposed to lead paint, older buildings where they do remodels or where paint is chipping, that's a really common source of lead toxicity. But here's an interesting one. We don't usually think of our red blood cells being related to stomach acid or gut absorption. So our digestive health can affect our red blood cell functions. And so here we have our optimal levels. So you'll see MCV on your blood work. And for this one, the optimal range is 85 to 92. So if you have anything outside of that range, go ahead and highlight it on your blood work. And here, a lot of overlap, but a patient, if it's high, same, impaired detoxification, fatigue, maybe having poor endurance, brain fog, slow starter in the morning, mid-afternoon slump, that kind of thing. Here's a different one. This could also relate to mood swings. So mood swings aren't always just a hormone imbalance or a female thing. Did you know that men can have mood swings too? Who's ever seen a man have a mood swing? Now I want to see your hands. That's what I thought. Yep, they have them too. Okay, and then if they're low, same. Brittle nails, hair loss, you could be weak or fatigued. Mitochondria comes up again, poor concentration, dizziness. So a lot of overlap. The next thing you'll see is MCH on your blood cell panel on your complete blood count. And this has, again, a lot to do with hemoglobin. So I'm going to go through just the changes. So this one, the only difference from what we've been discussing would be a potential vitamin A deficiency if you're low. And here's your functional ranges for this one. So functional range, which is optimal, is 27.7 to 32. So if yours is different, go ahead and highlight that on there. I don't see anything different as far as presentation for highs and lows. So very similar to what we've been discussing, a lot of overlap. That's what's really cool about the body. If you only had one body part that was responsible for a critical function like methylation, and it was kaput, and you either can do it or you can't do it, we'd be extinct. And so that innate quality of the body, the intelligent design of the body, is that there's multiple areas that all contribute and do the same thing, because if one is wiped out, the body's very good at being able to compensate and redirect nutrients and resources so that it can do it. The only problem is that when that condition of compensating persists for a length of time, you start to get other deficiencies in some other area upstream or downstream of that function starts to pay the price. So we don't want to stay in that constant state of always compensating, but it's really cool that the body can go to bat for us and has reserves and backup plans for these critical functions. Okay, so then you'll see MCHC, again related to hemoglobin per volume. Now, if this one's high, it's usually severe dehydration. So we put severe because I think everybody in Florida is dehydrated this time of year. So make sure you're drinking your electrolytes with your water to get the most out of the water you're consuming. But this is severe, so this means that you have really ignored the signs and wonders and continued to not drink it. You also could be severely dehydrated because of certain medications. It could be because of drinking things that contribute, like caffeinated beverages and some of these energy drinks and things that are high in sugar content can dehydrate you. Chronic diarrhea can cause dehydration. So again, yes, it's severe dehydration, but in functional medicine, but why is the patient dehydrated? What's the source of it? So that we can go and correct the diet, lifestyle, environmental contribution instead of just going oh, they have an anemia marker on their blood work. So again, asking why. Okay, so on this one, when you're looking at your blood work, it's MCHC, and the functional optimal range is 32 to 36. So just go ahead and highlight that if you're outside of the range. An interesting one here is if this is low, it's meaning you're not transporting oxygen to the tissues well. So this could be really cold extremities or general cold intolerance. So that's one little factor on MCHC if it's low that you might be experiencing. So just take note if that's something you're experiencing and go back and look at your MCHC and see if it's low as an explanation. Okay, and now we're gonna go into some RDW. I want to go back for a second. There's one little clinical pearl on your is that going back? There we go. When you see the MCV, MCHC, and all the M's, if all of them are low or multiple of them are low, that can indicate an iron deficiency. If multiple of them are high or at the high end of the ranges, that usually means the methylation issue or a B12 deficiency. So it's helpful to not just look at one individual, or if one is high and one is low, maybe it's not as meaningful. But if you start to see all those M's are low or all of them are high, that definitely means low is iron deficiency, high is B12 deficiency. That's a little pearl that wouldn't just be in the normal read it by, take the value at face value, needing to look at them in comparison to each other. Okay, RDW, I don't know why this toxin exposure is so high and bolded, but that is something that's different from the other ones that we looked at. Here, if it's high, it also can be contribute to poor thyroid function. So interesting to see our red blood cells related to now something that we think of as a gland or part of the endocrine system. So on this one, if you look at your blood work, you'll see RDW, and the functional range is 11.7 to 15%. So go ahead and highlight that if that one is out of the range for you. Again, we'll just gloss over same findings, same presentation patient-wise. Platelets is your body's ability to clot. So if you're not clotting, then you're bleeding or you're having a lot of bruising. That's one obvious sign. So people might have a lot of redness, from even just not banging their arm really hard, but a lot of that red blood bleeding looking, which is capillary fragility, fragile capillaries that are break easily. But it could also relate to poor wound healing or a poor inflammation response. This is something that's different if it's high If you have had your spleen removed, your platelets can be high. Your spleen often gets very ignored in traditional medicine, but it's really important for cleansing the blood and the maturation of red blood cells. That's where it happens, is in the spleen. So if you don't have a spleen anymore, it's going to throw all sorts of things off as far as this panel that we're looking at right now. And then low is a lot of similar things that we were talking about: autoimmune, viral, mold, or heavy metal infection or exposure, gut inflammation, liver disease. And then gets really interesting. So now we're going to go into the differential part. And I want to see if the percentages are on the sheet. Yes. Okay, perfect. Let's go back for a second. Okay, so now you're going to look, these will probably be under the WBC or the white blood cells on your paper. And there's all different white blood cells. So that's what we're going to start talking about, is the names of these different white blood cells and their different jobs. And with the differential, you'll know on your paperwork if you have the differential done, because it won't just say absolute. So you'll see neutrophils absolute, and that's just the total number. And then you might see the word neutrophil. You'll see neutrophil, lymphocyte, eosinophil, basophil, like all these words, and an absolute number. And then you should see those same 5 words, neutrophil, lymphocyte, basophil, eosinophil, right under that. And if you look, you'll see a percent next to them. Has everybody, I want to see how many of you have the differential. Are you guys finding the percentages on your paperwork? Some yes, some no. Okay, good. So you found them, so that's really good. So neutrophils are the most abundant type of white blood cells, and they're your first responders. So if you have a bacterial infection or your body's fighting some kind of injury or stress or inflammatory reaction, neutrophils are the first ones to come to the scene to try to clean that up. And so if they're high, it's usually when it's an immune responder, they're the first for bacteria. So often if there's a bacterial infection, it's the neutrophils come in. But it can be surgery or burns. It could be tissue injury or trauma. It could be an autoimmune flare, arthritis, or high cortisol. So that's the neutrophil's job. And so on the flip, if they're low, again, they could be low because they've been working really hard and there's been a bacterial infection that's not resolving, or there could be persistent tissue damage and injury, or persistent chronic inflammation and cortisol, and then the body gets depleted. And so now the neutrophils are wiped out and low because you haven't had enough of a chance to recover. So this is something to understand with our patients. Oftentimes when somebody comes in with an immune issue, we put them on a protocol to help them through that acute situation and to boost the immune system. And I think sometimes people are surprised that once the cold or the obvious impending symptoms are gone, that we don't necessarily take them off of their remedies right away. And I always say to the patient, well, we often want to keep you on your immune support much longer than the invader, because we want to boost your immune system so that you're better off from where you started, and also so that you're not susceptible to the next thing that your body gets exposed to. So that's really important with the kids going back to school and cold and flu season starting up, that some people just stay on immune support as a preventative, and we could talk about that too, so that you're already boosted before you get exposed, so that your neutrophils are all restored and ready to go to action like a little army for you. Okay, so neutrophils, the optimal range is 60%. So if your number is over 60%, the first thing that we're going to do is test you for bacteria challenges. Okay. So high, that's if they're high. So chronic common symptoms of bacterial type invasion would be fever, swollen lymph nodes. So we talked about the glands where you can check under the jawbone, under the armpits, and in the groin. Those are the most common, but there's ones in the front of this is your SCM in here, the muscle that you see on everybody that's really prominent. So you have a whole chain of lymph nodes in front of that muscle and also behind that muscle. And so sometimes people can feel, bumps or swellings on themselves and their kids in there. So you can kind of feel up and down and under the jaw and see if you feel anything swollen or any tender points. It could be abdominal cramping, a lot of times bacterial infection, or you might hear of a gut dysbiosis, which is an imbalance of good and bad bacteria. SIBO is a common word that's thrown out a lot, but bacterial infections of the gut. It can be fungal infections. A lot of times there's overlap, and I think people get kind of confused, like, well, is it bacteria or fungal? A lot of these immune invaders, they kind of piggyback on each other. So if there's one, there's probably another. And in our medicine, if you're boosting the immune system, it can handle any of these invaders. So there's not always like a fungal pill and a bacteria pill and a parasite pill. There are remedies that we use that, if we know what we're dealing with, that are more effective for one or the other. But the whole goal is to boost your immune system and get your neutrophil levels to the right range so that no matter what your body needs to defend against, it's ready. Okay, so that's a little clinical pearl. Over 60% can indicate a potential bacterial infection. The next number you're going to see is lymphocytes, and this is just something called your adaptive immune system. These tend to respond more to viral infections, but they can also be a sign of autoimmune triggers and chronic illness. So if this one's elevated, there could be acute or chronic viral infections, or there could have been a virus, and now the immune system is trying to recover from that. On the autoimmune side, it's often elevated with Hashimoto's or lupus. And here's some symptoms of those type of conditions: fatigue, swollen lymph nodes, low-grade fevers. So sometimes I think this gets looked over. If you know your basal body temperature and you have like 98.6 is the natural temperature, but sometimes I think people don't think, like, if they're constantly running at 100 that's abnormal. But that could be a sign of one of these, like, behind the scenes chronic ongoing viral infections that hasn't been effectively handled by the body. Okay, so then if it's low, it could be because of malnutrition or protein deficiency. It could be zinc deficiency, adrenal exhaustion, which is like the majority of our patients. So that can be related to a poor immune system or weakened immune system. So we kind of understand that. Your adrenals are what handle stress, or your body's ability to handle stress. Stress can cause immune suppression. So see how it all goes hand in hand. And then you might see that as a low lymphocyte rating on your blood work. Here's another thing if you guys go and look at your blood work real quick on these percentages, it's a percentage of the whole. And so when you look at the percentage of lymphocytes, monocytes, basophils, eosinophils, neutrophils, those percentages are always going to add up to 100. So what that means is if one of these numbers is elevated, something else is going to be low because they have to all add up to 100. So it's just a little fun thing to read. They always add up to 100 or like 99.9 depending on the lab, because it depends on how many decimal places it goes out. Is everybody adding it up to see if they add to 100? Here, check in your labs to make sure their interpretations are accurate. Okay, so that's the lymphocyte. So the lymphocyte functional range is 30%. So if it's over 30%, it's often a sign of viral infections or some of these autoimmune things that we talked about. But viruses, that was not coming out good. Epstein-Barr virus, EBV, or the Lyme virus, Lyme disease causing virus, and co-infections are one of the viral infections that are often dormant or hidden or running in the background for patients. This condition is very often missed from traditional medicine. It's a really tricky thing with traditional blood work to identify and to diagnose. And unfortunately, it's a really sad thing because patients who have had Epstein-Barr or Lyme or the co-infections like Bartonella, they often suffer a really long time before they even get a proper diagnosis in the traditional world. So that's something that just naturally falls in the lap of functional medicine that we've had to become very versed in handling because there's a big hole in understanding it, detecting it, and treatment for it. But it can be effectively handled. That's what I want people to know. I think it's one of those conditions that there tends to not be a lot of hope for because of the misunderstandings. But we can easily identify it and handle it in functional medicine. So that is the lymphocytes. And then the next one that you're going to see is monocytes. And monocytes if there's any kind of pathogens, they come in and engulf it. And if you have had the live blood cell analysis, you could actually see these. Like they're really big on the live blood cell analysis. And they help with inflammation, tissue repair, detoxification, and chronic infections. And so if these are high, it could mean any of those. This is where we can maybe see a correlation with leaky gut or either previous or current mold exposure, autoimmune again, molds, heavy metals, chemicals. The body's trying to clean something up, so obviously there's something in there that shouldn't be if we see the monocytes that are elevated. So low could be some of those symptoms that we talked about just like toxin overload or burnout, because the body's been trying really hard to clean it up and it's been persistently in there. So the functional range for these is 7%. So if you see a number higher than 7, it can mean chronic infections. It can be some of the autoimmune like lupus, RA, Hashimoto's, and you might recognize that with joint pain. And if it's Lyme or the co-infections, it's often migrating joint pain and stiffness. In severe cases, patients talk about they wake up one day and their shoulder is locked up, and then the next week it's their knee, and then this week it's their hip. And so it moves around because Lyme really likes to hide in the joints and in the tissues. And so that's hard to diagnose too, because they might seek chiropractic or massage therapy or something on the physical medicine side of it. And the practitioner can't find anything wrong with the joint, right? It's not a tear, it's not a subluxation, it's not a sprain or strain. There's no indicator. Obviously, they are hurting there, but they can't diagnose a joint problem. And then as soon as they try to treat that area, the next week they're coming in for some other condition, and then they try to identify and find that out, or they get x-rays and the x-rays are negative and the imaging doesn't show anything. So just again overlaying the patient presentation with potential lab findings. And again, if it's over 7, it doesn't mean you have Lyme or autoimmune, but these are things to look for. But something's going on. It's definitely the body's cleanup mode. It's trying to clean up something. There's something in there that doesn't belong. So we got to find it. The next one is eosinophils. This one's really interesting because it's the main indicator for parasites. And we see that all the time. That's another one that traditional medicine doesn't really they don't recognize it's not that they don't recognize parasites, but in their world, it's like if they can't find them and see them, it doesn't exist to them. And they still think for some reason that parasites are only in the stool. And that's not true. So they'll do a stool culture or a stool collection, and analyze it for parasites or the ova, which are their eggs. And if they don't find it, they say the patient doesn't have parasites. And that's not true. Parasites are really tricky. I don't want to gross you guys out, but it's inevitable. Parasites can be found in the brain, in the eyes. They can be found in the thyroid, in the liver. They like to tuck up under, like in dark crevices in the body. So like under the gallbladder, like between the gallbladder and the liver, they like to tuck up under there. They definitely can be in the gut. They can be in muscles. They can be anywhere. And so having a stool sample, even functional labs like a GI map, the not finding it, just they take the tiniest little piece of stool to analyze. And if the problem is in another piece of stool somewhere else, you still could have them. But even if they're not in the stool, you could have them somewhere else. So that's again another condition that's often misdiagnosed or missed altogether. And then it also can be autoimmune. So it's usually parasites or autoimmune. They can also be high in histamine regulation. Histamines are allergies, allergic type reactions, and allergic type reactions aren't always what we think of as like eyes, ears, nose, throat, sinus. Maybe people don't always realize, but the majority of histamine is actually made in the gut. So a lot of your bloating and GI distress and discomfort and gas and malabsorption is because of high histamines. And there's actually a genetic mutation where people are, if they have the a mutation in the DAO gene, they can be histamine intolerant. And that's really interesting because people who have histamine intolerances, they could be eating things like probiotics and sauerkraut and apple cider vinegar, thinking that they're trying to heal their gut, which is all over social media and influencers and nutritionists everywhere, and they could actually be causing themselves a whole lot more stress. So here's one of those examples that like what's healing to one person could be another person's nightmare. And even though they're healthy foods, they can be hurting you if depending on your body. So this is why you can't always just DIY everything and follow the crowd because it might be not the exact right thing. But functional medicine tries to get everybody like very individualized on the exact right diet and eating and supplement plan. And while we're talking about histamines, it's important for people to know that the main probiotic that's in all the yogurts and is in a lot of the probiotics over counter, probably because it's inexpensive to make, is lactobacillus, which comes from lactose, which is a milk product. But lactobacillus is a really high histamine producer. So do not take lactobacillus if you suspect that you have a histamine intolerance or if your eosinophils are elevated. And again, if you're curious on this stuff, we can muscle test you on particular foods. So our patients can bring in yogurt and sauerkraut and all these different things, and we can just let the body tell us yes or no. It's pretty cool. Okay, so the functional range for eosinophils is 3%. So if it's over 3, you can start suspecting some of these things that we are discussing, but it's usually a lot of gut discomfort. It could be unexplained weight loss. Parasites steal your nutrients from you. So even if you're eating enough, you might be losing weight. Itching and rashes. We've somehow made a name for ourselves. Parents parents bring all their rashy, itchy kids to us, and often it's because and we find eosinophil elevated, and we find immune challenges like parasites or yeast, fungus, mold, which is gut dysbiosis. So we got to get their guts better. We got to support their immune systems. We've got to get their nutrients that they've been deficient in not absorbing replenished. It's a big job. It's not as easy as just lathering a cream on the itchy skin and moving on. And then the last one is basophils. And so basophils, they're the least abundant of the white blood cells, but they are mostly activated in the histamine or allergy response. So this could be mast cell activation. histamine, hay fever, eczema. It could be mold. Mold is a really common trigger for basophils. It could be leaky gut. Worst case scenario, leukemia, which is not the most common. We have to list it there. And if it's low, then people have an acute allergic response or overactive cortisol. So that is the CBC with differential. So I'm going to stop the share for a sec. So did anybody find some abnormal flags on their blood work that wasn't flagged from the lab or from their medical doctor? You can tell me or put it in the chat. You guys discover some things. Okay, so we are at 6:30. So let's go ahead and pop up a real life case so that I can show you an example of analyzing something a little bit differently. All right, share. Well, it's good if you didn't find any flags. We didn't want you to have anything wrong. Yeah, some people are finding stuff, some people not so much. I mean, that's great if you don't, but there's some cool stuff in there. Yeah, good. I'm glad you're learning things. It's important. Like you guys have this blood work and it's yours and it's your body. So it's important that you know what it means and how to interpret it. And even just, for next time, your blood work, you get it done on the regular. And maybe next time you get a flag and then the optimal for basophils. Thank you. I didn't say that. Miss Linda thinks it's 1%. So if basophils are over 1, you're outside of the normal range, and that's usually a histamine. Okay, let me pull up a real live case for you guys. Okay, so this was a case that we analyzed this week. And so this was the one where if we scrolled, there were only 5. So here's one, right? Her alkaline phosphatase was low, cholesterol. Usually cholesterol has 1 or more abnormals, TSH. There are only a couple of flags on there. So when I analyzed it per our functional ranges, we came up with 14 flags. So first we need to know about this patient because we never just take the numbers at face value. This is attached to a real live living human person who's seeking health improvement. So this is a 30-year-old female who came in with chronic joint pain as well as all over pain. She was experiencing fatigue, diarrhea, insomnia, brain fog, and anxiety. Does that sound like anybody else that we are talking about? I told you our patients come in with a lot of very common symptoms. So she had previously worked with a functional medicine doctor and she had gotten some results, but she was plateaued. Like she felt like she was stuck and couldn't get the rest of a resolution that she was expecting. So she brought us the blood work, which is here. What she also brought with her, which we're not going to cover on this one, but if you guys like this format, we can definitely do this again and go over hormones. We can go over thyroid. We could go over the metabolic panel. We could do this for a lot of things. And then we also could do it for more of the functional tests. But she brought in her blood work. She brought in a GI map, which is a more extensive gut test. And she also brought in her Dutch test, which is the hormone panel. And so when we analyzed this, let's go down to her CBC. Let's see if you guys can find anything. So is there anything on here in the differential, the percentages? Do you see any numbers outside of the ranges? So go ahead and pop it in the chat if you see any abnormals. Let's see how good you guys are detectives. Okay, so what we see real quick is her lymphocytes are over 30%. So often that means a potential, what did we say? Bacterial. So maybe that's why she's tired and burnt out and in pain. That can be chronic inflammation. Okay, so then we looked at her chemical panel, which we didn't really go over a lot with you guys, but a lot of doctors at least will order something that looks like this, which will have glucose, your hemoglobin A1C, and all of your kidney, liver values, your electrolytes, some nutrients. It has liver enzymes and all of the iron panel. This lady's doctor was a functional doctor, so they ordered some more extensive. So you're going to see things that were not always on everybody else's. But this patient, when we looked at it, we found chronic ideas of her stomach. Oh, sorry, this was her muscle testing. So it kept pointing to autoimmune, it kept pointing to her liver, and it kept pointing to like leaky gut markers. And so it was interesting because then we muscle tested any of the areas that showed up on here that didn't show up on previous muscle testing. And it really confirmed for her. I thought what was interesting for this person was that it really started to confirm what we had already muscle tested and then helped us just fine tune it and get a little bit more specific. So when we went back in her muscle testing, we had already identified stomach, adrenal, liver, and joints. And liver kept coming up repeatedly in her findings with those methylation things that we were talking about, poor methylation, potential B12 and folate deficiency. And then her interferences are COVID. So she was testing for immune panels for COVID, Babesia, and she tested for viruses, parasites, and multiple chemical sensitivities. And so her program with us was Marcozyme. She was on proteolytic enzymes for inflammation, Catalyst 7, so she was already on digestive enzymes for food sensitivities. She was on biotoxin binder because of metals or chemical sensitivity. And we had her on drainage activator. And so when we met with her for the blood labs, what we found out was that she was not tolerating her detox protocol very well. So we had to slow down her immune challenges and we had to take her off of her drainage activator and switch her over to a different lymph drainage product, which is Lymph Active. And the reason we had to do that was because drainage activator, even though it was helping her drain, it was actually detoxifying her faster and causing more of a detox reaction. And so because of her blocked detox panels and her poor liver clearance or methylation, it was just contributing too much to the detox. So we actually had to slow down her detox and decrease the immune protocol and just more back into it. And then what we did after her labs was we added the kidneys. So we found out that part of her detox drainage challenges was because her kidneys weren't draining. So she had 3 actual pathways, gut, kidney, and liver, that weren't detoxing. And so this is a great example of patients working with other practitioners. What we find is that a lot of times they're doing really good things, but they're doing them in the wrong order. And what we needed to do was just slow things down and back up and get more root cause and open up her drainage pathways and get her ready. And so this is still a ... because she's still actively under care with us. And we will keep her going and keep her supported the way we need to. And we will get her a full resolution and repeat her labs in the future. So that is everything for tonight, you guys. I hope you found this really helpful. Like I said, we can do this for other values. If you guys have other suggestions on things that you want analyzed in the same manner, let me know. If you would like a one-on-one to go over your blood labs, personally, let me know as well. And we can definitely meet in office or on Zoom or on a virtual appointment to do that. So I hope you guys learned a lot and that helps you take your health to the next level. If you don't have labs, we can order them for you. So just let us know how we can serve you. And then look out in your email boxes for my functional panel. I'm going to send you all those functional ranges for what we went over tonight, as well as the metabolic panel, so you can self-analyze and then you can reach out with any other things that you need help with. Yeah, you guys are so welcome. You are an awesome audience. Thank you for engaging with me and being on here tonight. It was fun. In good health naturally, this is Dr. Kristy signing off on another episode of the Weird Works podcast.